It is a joint conference involving the Minister of Health, the Director General of the National Agency for the Control of AIDS, NACA, and the representatives of Global Fund. The Director General of NACA leads the discussions, highlighting the role of Global Fund in financing Nigeria's healthcare sector, especially the fight against infectious diseases like HIV and tuberculosis in the last 1 decade.
The Global Fund is responsible for most of the malaria prevention programs in the world. It's also responsible for at least 140,000 Nigerians we currently have on treatment. The Global Fund also funds at least 100,000 Nigerians on TB treatment. Without the Global Fund, Nigeria would have struggled to deliver some of the huge interventions we have put in place for these 3 deadly diseases.
As Executive Director of the Global Fund to fight AIDS, tuberculosis and malaria.
Even though Global Fund has invested over $2 billion into Nigeria's health sector in the past, the fund is committing another $660 million for the treatment of infectious diseases in Nigeria within the next 3 years.
Nigeria is the country in which the Global Fund invests most money in the fight against AIDS, TB and malaria. As the DG said, we have invested significant amounts of money. So far we've invested $2.6 billion. And in the current funding cycle, which is a 3-year cycle, we are investing $660 million.
In his remarks, the Minister of Health expresses government's appreciation to Global Fund, while restating government's commitment towards increasing domestic funding for the sector.
I want to assure the ED that we will also improve domestic resource allocation to HIV, TB, and malaria in 2019. Government has demonstrated resolve. In 2019 budget, the Basic Healthcare Provision Fund will be retained. There will be the same 55.1 billion in our 2019 budget. Government is also putting 22 billion for vaccines as a commitment to ensuring that every Nigerian child gets vaccinated.
The National Health Act 2014 provides that 1% of consolidated revenue of government should go to universal health coverage. However, 4 years after that law was passed, the provision has not been fully implemented, as the sector still relies heavily on foreign donors.